Hello friends, I Dr. Vinesh Kumar welcome you in this video, and today we are going to discuss the difference between general anesthetics and local anesthetics. Before dealing with the difference, first we will see the basic definition of anesthetics and where these are used, then we will see the difference. See, the anesthetics, these are the drugs which are used in surgery. But why? These are the drugs which are used in surgery to produce anesthesia. Now, what is anesthesia? Anesthesia, it is a state of unconsciousness if we are using general anesthetics. It is a state in which reflexes are lost. It is a state in which if the dose of this is increased, the immobility is also there. Means it is a state in which sensations are also lost, a state in which pain sensation is also lost. So we can say that anesthetics are the agents which are responsible for loss of sensation, reflexes and consciousness if we talk about the general anesthetics. Now, depending on the surgery, we have to use either general anesthetic or local anesthetic. Now we can see that surgery is of two types. Either it can be minor surgery or it can be major surgery. If the surgery is major, we have to involve the CNS, and in major surgery we are using general anesthetic. But if the surgery is minor, for example in case of tooth extraction and dental procedure, we have to use local anesthetic. Because in minor surgery we are confined to only a particular part of the body, so in that case there is no need of using general anesthetic. So this is the basic definition of anesthetic. Now we will start the difference between general anesthetics and local anesthetic. See, these are the points. These are the basis on which we will be differentiating between general anesthetic and local anesthetic. This is general anesthetic part, this is local anesthetic part. We will start with the site of action. Now, site of action means where the anesthetic will work. So first is site of action. If we talk about the general anesthetic, the site of action of general anesthetic is CNS, central nervous system. It means brain and spinal cord are involved. But if we talk about the local anesthetic, the peripheral nerves are involved. There is no involvement of central nervous system. So this was the first point. Second is area of body affected. If we talk about the general anesthetic, the whole body is involved. The whole body is affected when we are using general anesthetic. But if we are talking about local anesthetic, only the local area or a restricted area is involved. For example, if we are using local anesthetic for dental procedure, the dentist gives only at this part, and while the extraction process or the dental surgery is going on, only this particular area is affected by this. So we can say that only restricted area is affected. So this is the peculiarity of local anesthetic. Now, third part, difference on the basis of consciousness. If we are using general anesthetic, there is loss of consciousness, means consciousness is lost. But in local anesthetic, the consciousness is unaltered and it is maintained. Again, I will give an example. Suppose surgery of this finger is going on. Only this part is affected by local anesthetic. The patient can easily see. He is well aware what is going on. So this is local anesthetic part. Fourth part, care of vital functions. Care of vital function means we are talking about the heart, we are talking about the respiratory parameters, we are talking about the blood pressure and other things. So if we are using general anesthetic, these all functions are very essential. These should be carefully monitored, because use of general anesthetic, it is a very complex process. But in case of local anesthetic, it is not needed usually, because local anesthetics, it remains in a particular part of the body, but it affects your brain, it affects your whole body. As we have just seen, this affects the whole body. Therefore, whenever we are using general anesthetics, care of vital function is necessary, monitoring of vital function is necessary. Now next difference, physiological interference. When we are using general anesthetic, physiological interference is very high, or we can say that physiological trespass is there. We know general anesthetics, the site of action is CNS, central nervous system. The brain is the main part, and we know in brain various different centers or various centers are there which regulate the body functioning. Therefore, if the dose is more, or even if the dose is not more, if we are talking about the normal dose only, these affect these different centers, and therefore they can alter the physiology also. We can say that general anesthetic, they trespass the physiological functioning or they interfere the physiology of the body. General anesthetic part, they have high interference, while local anesthetic, they have very low interference. Now next difference, poor health, means we are talking about the patient. If the health of the patient is poor and if we are using general anesthetic, it is very risky. For example, if the patient has bad lungs, means the condition of lung is not proper, the liver is not functioning properly, the heart is not functioning properly, and in that case, if we are using general anesthetic, it is highly risky. But in case of local anesthetic, it is very safe in comparison to CNS. Or again, we can say that the use of local anesthetic, even if the condition of the patient is poor, these are safe to use. Next difference, on the basis of use in non-cooperative patient. Non-cooperative patient means patient is unconscious. If we are using general anesthetic in the patient who is non-cooperative or unconsciousness, the use is possible, we can easily use, but it is not possible in case of uncooperative patient or non-cooperative patient. Next difference, major surgery. For major surgery, general anesthetics are preferred, but local anesthetics cannot be used for minor surgery, because just when we started the video, this discussion, we have dealt with this thing. Now next, we are talking about the minor surgery. When the surgery is minor, the general anesthetics are not preferred, only local anesthetics are preferred, because what we want is, we want the loss of sensation in a particular part of body. And just now I have told, the use of general anesthetic is very complex. It involves your body parts. It can alter the physiology. So why to go for the complex process when we have already choice for this local anesthetic? Therefore, in minor surgery, local anesthetics are used. Next difference, we will see the examples. Many examples are there. We have taken only one example. Example of general anesthetic, like halothane. You can also write enflurane, sevoflurane, like that. Local anesthetic, lidocaine, xylocaine, liglocaine, like that. Next, difference on the basis of mechanism of action. Here we are differentiating on the basis of receptors involved. General anesthetics, they show mechanism of action, or they show the action, or they show the pharmacological action by interacting with the GABA receptor, GABA A receptor, gamma aminobutyric acid receptor. They show GABAergic action, and we know that if the action is GABAergic, it suppresses the CNS, and by this way they show their anesthesia or anesthetic action. Next receptor is NMDA. NMDA means N-methyl D-aspartate. So what general anesthetic do? General anesthetics, they inhibit this receptor N-methyl D-aspartate. So two receptors are involved, GABA receptor and NMDA receptor. But if we talk about the local anesthetic, they block sodium channel, which is responsible for nerve impulse conduction. Now how they do, I am not going in the detail. We are just confined to receptor only in this video. For details, we have to see other videos uploaded on the channel, and for that please subscribe, and also don't forget to press bell icon, so as soon as the video is released, you will get the prior notification. Next difference is pre-anesthetic medication. See, what is pre-anesthetic medication? Before using general anesthetics, and we have seen it is a very complex process, and in order to anesthesia to become smooth and easy, we are using certain medicines which are part of pre-anesthetic medication. Many medications are used in this, like antiemetics, anti-secretory, like that. For medications which are responsible for pre and post-operative amnesia. For details, go through other video which is already uploaded. Now, pre-anesthetic medication, if we talk about in general anesthetic, this is needed. But when we are using local anesthetics, there is no need of pre-anesthetic medication, means it is not required. Next difference, if we are using general anesthetics, there are different stages of anesthesia involved. 4 stages are there: stages of anesthesia, stages of delirium, stage of anesthesia, and stage of medullary paralysis. But if we talk about local anesthetic, no such stages are involved. Now, apart from this, one more difference is also there. If we talk on the basis of the user means the patient, user means we are talking about the doctor or the medical practitioner. If we talk about the medical practitioner, this use is complex. Means use of general anesthetic is complex. It requires machinery. It requires special supervision. But in case of local anesthetic, this is quite not that much complex. It is quite easy. Means this process is far easy in comparison to general anesthetic. Not that much machinery and things are required. I am talking on the basis of medical practitioner, the person who is using this in the patient. So these are the differences, and by this way we will keep on interacting and making the things easy. Please be in touch and don't forget to subscribe channel. Thank you. Best of luck.